Good morning, everyone. Welcome back. Doing the hand today. Got my models all ready to go. Couple of few weeks of the elbow. A bit of an awkward area. We talked about that before, about it being an area that you kind of just go, oh yeah, there's a radius ulnar and humerus, and that's kind of it. Good morning. Oh blimey, we are honoured today. Hi, Catherine. Able to make the live. Good. Yeah, good to see you. Just for those of you that are new to the group, there is a little there's a little link on the videos where it asks for Ecamm asks for permission to use your profile picture. So if you don't click that link, then it looks like this. So good morning, whoever that is. I've no idea, I'm afraid. But if you have clicked it, then you look like this. Morning, Stevie. Yeah, all good, thank you, mate. And good morning. And again, it's just Facebook user, I'm afraid, so I don't know who you are. So if you click that little link, then we'll be able to see who you are and who is making comments whilst we're doing the live session. Ah, blimey. Yeah, Tristan's back as well. Yeah, well, we are blessed today with a few of the old familiar faces. Right then, let's get going. So, so we covered the elbow over the last few weeks and finished off all the nerves of the around the elbow region and the blood supply the week before. So, what we're going to look at doing now is follow that down into the hand and wrist so that we complete all of that section. And it will link in as well to the stuff we did in the neck because and the brachial plexus, because the nerve roots that supply the wrist and hand, you will get common patterns of sensory loss or motor loss in different areas depending on where there's an issue in your neck, or if there is one. There are other reasons for those problems as well, but quite common radiculopathy issues. Yeah. Royalty. Are you talking about Catherine there, or Tristan? Surely Catherine, Queen Catherine. Right. Let's get going then. So just get that there. Right. So bones and bony landmarks of the wrist and hand, and it's very similar to the foot in that there's a lot of stuff going on, but when you kind of break it down, and hopefully we'll make it a little bit simpler for you to understand, and we'll do things in rows and segments so that you can get an idea of how everything is structured within the wrist. The If you're a therapist, the examination of the wrist is pretty difficult because all of the bones are really close together, and it's difficult to palpate big bony landmarks, let alone really small ones. So there are a few little tips and tricks that I'll show you along the way of how to know whether you're on certain structures, which will help guide some of your clinical reasoning. But again, it is really tough, this area. So it's one of those where you will probably think there is something going on, but you can't tell for sure. You'll have some suspicions, but you would need further investigations to know whether anything's whether something specific is going on. So it's a difficult area to palpate and and do your clinical reasoning skills basically. But hopefully, with all the little tips and learning the detailed ways to find things, then you'll find it a lot easier. So let's have a look. So what we're going to do today, as I was putting this together, I was thinking there's quite a lot to get through. So I don't know whether we're going to get to the fingers today, whether we're going to be able to get to the hand. So I'm going to try and just try and focus on the wrist and the carpal rows and the joints around that area, and then we'll see how we go. But if I can, then I'll get into the fingers as well. But we'll just see how it's all going. So just grab my arrow. There we go. This will send Catherine's cat crazy. I'll do. There you go, if your cat's watching. So we've got articulations. So those are the joints. And I've mentioned this a few times. So articulations, if you've never heard that term before, if you think of an articulated lorry, and they're the big lorries where they kind of join in, where the cab meets the main body of the truck. So articulated lorries and articulation. So it's where things join. Okay, where things join against each other, the bones. The movements of the wrist and where those movements come from. Because if you're a therapist, then that's really helpful, because if someone is struggling with a specific movement, then you can narrow down the area of the bones, especially in the carpals, that may be a problem with that person moving in that direction. Okay, so you can try to narrow down things once you know the movements, and then bony landmarks, and that's really key as well, because there are certain areas you can palpate, there's certain areas you can feel, but there are some that you can't, and you'll struggle with. But also, if you go into further study, and you'll know over the last, well, nearly over a year now, nearly a year, I've been studying sonography, so how to do ultrasound scanning, and I've been doing ultrasound scanning of the wrist. And there are certain landmarks that we use on the wrist to then identify other structures. So if you just put the ultrasound probe on and go, right, what's that? And you're just learning, then you're like, I haven't got a clue. But if you find a bony landmark and then work from that, you then know what the structures are, either behind it or in front of it or to the side. So it's a lot easier to figure out what structures you're looking at once you know all the bony landmarks. And again, if you don't have those probes and being able to see through the skin, then there are some areas that you can palpate quite easily, and then you'll be able to you'll to a certain extent be able to feel some structures. Okay, so again, we'll give you some clues on that. Cool. Right, just move me over there. So if any oh there's a few on there. Right. It was Julie. Julie, you are working now. Yeah, thank you. Yeah, for some reason my feed wasn't updating. Robin, yeah, you should no longer be a Facebook user now. Yeah. Tristan, Bo. Okay, yeah, good. um, and good morning, Steph. Good morning. That's all right. No worries. We've only just started. So you'll have to play this back to your cat then, Catherine, and yeah, that arrow will send her nuts. Cool. So let's get going. So we've had a look at this before. So we've had a look at the radius before, and this will hopefully help to piece, especially pronation and supination from the elbow together for you, so that you can understand what's happening at both ends of the bones. So this is the radius bone, and we've had a look at this previously. So we looked at it on the what we call the proximal end. So this is proximal is the part nearest to you. Distal is the part furthest away. So you can say approximate as proximal and distal as distance, and that might help you remember which is which. So this bit we've had a look at before. So this is the head of the radius, and then we've got this lump here, which is the radial tuberosity, and we were looking at the biceps attachment into that point. So, and that's one of the main drivers for supination. So we've had a look at this area in some detail over the last few weeks, and now we're going to have a look at this bit, and this bit here is the distal part, and this is where it should hopefully start to make sense. And when we have a look at the videos in a sec as well, you'll see. But you see up in the elbow, the radius is really small, but at the wrist, it's really big. And the opposite is true with the ulnar. So the ulnar is really big at the elbow, but then really small at the wrist. So the ulnar at the wrist almost looks a bit like the radius at the elbow. They kind of switch around each other. And when you see things moving in a second, you'll see how the hula hoop annular ligament that we saw on that radial head, we've got a very similar structure in the wrist, wrapping around the ulnar. So it's fascinating. Well, I think it's fascinating how they kind of mimic each other, and they look really, really similar. So hopefully you'll be able to work out how things move. So yeah, so the shaft section of the radius gets broader as it goes more distally, so towards the hand, so in that distance. Has an anterior, a posterior, and interosseous border. So we've had a look at this previously, where we've looked at the membrane that's in between the radius and the ulna, that interosseous membrane. And interosseous just means in between the bones, okay? And as you will have seen on some of the blood vessels around the elbow area and the nerves and the blood vessels use that interosseous membrane as a bed. So they use it as a bit of a floor and a ceiling, depending on which side they're running along, and it separates the front and the back of the forearm. Okay, so we'll have a look at that in a bit more detail as we go down the forearm. The distal end of the bone is marked by something called the radial styloid process and Lister's tubercle. Okay, so first bit of palpation. So you get your wrist. Obviously, we've got the thumb side here, so that's the radial aspect, and then the little finger side here is the ulnar aspect. Best way to find your styloids is by gripping your radius and ulnar and then sliding towards the wrist. And what you'll find as you slide up, you'll find these bony lumps. So that one just there on the ulnar side, and then the radial side is a little bit higher up just there. Okay, and that's your radial styloid, that point there, which is on this bone here. And we'll have a look at that in a bit more detail as we go through. And then this raised lump area here, that's called Lister's tubercle, and we're going to talk a little bit more about that when we get into the muscles. That Lister's tubercle is is kind of like a raised crest that separates different tendons in your wrist as well. Okay, so but again, when we get to that part, we'll talk a bit more about that. You've got two facets, and you've heard about facets before. So we've had facet joints in the spine, and it's smooth surfaces that glide along each other. And we've got two facets for articulation with the carpal bones, and those are on the ends of the radius, so on the end here. Okay, so that's a bit of an overview of your radius. Let's have a look at the ulnar. So hopefully you'll be able to see what I was trying to get at with the way that the ulnar seems flipped. Okay, so at the elbow end, the ulnar is really big, and then at the wrist end, the ulnar is really small, and it actually looks a bit like the radial head. Okay, so it's kind of circular in shape, and then this sticky out bit here. So that sticky out bit is that bit. Yeah, so where we've got the radial styloid on this side, on your thumb side, we've got the ulnar styloid just on there. Okay, so those are the styloids, and that's that sticky out bit there. So the ulnar narrows distally, whereas the radius gets broader. So we've got a switch in the structure. Also has an anterior, posterior, and interosseous border, so because obviously they join together. The posterior border is palpable along its entire length, so you can feel the entire ulna all the way from the elbow, your olecranon, which is your ulna, all the way along, and then carry on until you get to that ulnar styloid just there. So you can palpate the whole length of that bone quite easily. It's quite superficial. And the distal end is small, characterized by the ulnar styloid, which is that little lumpy bit there, and the head of the ulna, which looks a bit like the radial head, but obviously it's at the other end. So that's a bit of an overview of the bones there. Let's go into a little bit. Here we go. Yeah, so this text is taken from the Trail Guide to the Body. So if you haven't seen that book before, and especially if you're a therapist, well worth getting the book. So if you have a look at something like Netter's Anatomy, I mean, they're really good, they're really detailed, but they don't tell you how to find stuff. Whereas the Trail Guide to the Body definitely does. So the radial styloid as the radius gets bigger, so we've got that lump on the edge there, which is obviously on the thumb side, and it talks you through how to palpate those. So when you're watching this video back, you can pause it here, have a look at the instructions, and then you can do that yourself. We've got the head of the ulna as well, so around that area there, and then the ulnar styloid, which we've just seen, well, just demonstrated how to get that feeling all the way along the shaft, and then right onto that little point on the end there. Okay, I'm just going to make sure we've got no questions there. Good. And then this is the opposite view. This is a dorsal view. So on the styloid process here, radial styloid there, and then you've got Lister's tubercle. So using the thumb, locate the dorsal surface of the styloid process of the radius. So you have a feel of the radius just there. Now, I haven't mentioned dorsum and palmar. So in the foot, you've got dorsum and plantar. In the wrist, we've got dorsum and palmar. So palmar is obviously to do with the palm of the hand, and dorsum is the back of the wrist. So the dorsal surface is this surface, and the palmar surface is this one. So when you see there that you need to locate the dorsal surface of the styloid process. So you got your styloid process just on there, and then the dorsal aspect is around this side. Okay, so you have a feel around, and if you run side to side across that bone, you should be able to feel a lump right at the end of your radius, and that, oh, there it is. Yeah, and that lump there, you might have to track up and down a little bit, but that lump there, that's your Lister's tubercle. Okay, so and we'll talk about the importance of that as we go through. And then your radial styloid, which we saw before, is just here. Okay, right, let's have a look at that. So we're going to have a look at the videos of that now. Okay, here we go. So this is what we've just been looking at on the pictures. So this one, because it's smaller at the wrist end, it's obviously bigger at the elbow end. So this is the ulna. There's the little styloid process just there. This is the radius. Okay, so that it's thicker at the wrist and smaller at the elbow. There's the radial styloid. It's not as lumpy as the ulnar one, so you could probably feel the ulnar one quite easily, whereas the radial one just feels like a quite a broad raised lump in that position there. And then we've got these little facet joints here, so they articulate, they join, and with the articulated Laurie, they join with the carpal bones, which are your wrist bones, which we'll have a look at in a second. Okay, so let's have a look at this. Okay, so radius and ulnar, and then here you can hopefully see how the surfaces of the ends of the radius are quite smoothed. Yeah, so that this is where the carpal rows will attach, but we don't get attachments on the ulnar. There's something else in the way, which we're going to have a look at in a second. So there's the head of the ulna, which again, look at that, it looks very, very similar to the head of the radius at the other end, so towards the elbow. And then we've got this groove in the side here where the ulna fits in. So the ulnar styloid, so the pointy bit there, and then the radial styloid just there. Let me just pause that. So the reason why we've got these lumps and bumps, similar to every other part of the body, where you have an attachment point for something, where there will be an element of stress in that region, you will grow bony lumpy bits to adapt to the stress. So the things that attach around here are the ligaments of the wrist, and we'll add those on over the weeks, but you'll see that the ligaments will attach onto these styloids, and because of the movement of the wrist and the range of movement we've got, as the ligaments are developing, they'll get pulled slightly, so, and then they'll pull on the bone, and then we'll develop these styloids. Okay, so again, they're going to be different for everybody, and if you've had an injury there, it will be different again. but it's similar to all the other lumpy bits basically in your body. Okay, so there you can see the join between the radius and the ulna from the wrist side, radial styloid just there. And then this is what it looks like in the flesh, if you like. So let's just play that back again. So if I just go back to there. Okay, so we're going to add some of the layers on. I'm going to kind of jump ahead a bit, and then we'll strip it back over the next few weeks. But if you remember what it was like in the elbow, where the radius would spin, okay, around that inside that annular ligament, we've got a similar kind of setup here. So if you have a look at this, the radius will rotate over the ulna, and the ulna stays still. Okay, so there's the ulna. You can see it without the capsule around it here, and then there's the radius, and we've got this stuff called the triangular fibrocartilage, and we'll talk a bit more about that next week, but that's shortened to TFCC. So if I just pause that there, so the TFCC, triangular fibrocartilage complex, is a specific structure that helps to stabilize the outside of the wrist. Okay, so whereas on the radial aspect, so on that thumb side, we've got those little faces, those little articulations where the bones sit into. On the ulnar side, we don't have that. We've got the TFCC, which is a bit of cartilage, which provides a flexible structure to allow the wrist to rotate, so pronate and supinate. Okay, so I'll just pop that on again, just go back a little bit. So there's the TFCC, there's your radius, there's your ulna, and the radius will literally just rotate around that fixed ulna. So if you imagine that at the other end, that's now spinning in the annular ligament, and now it's also spinning around the ulna at the other part. Okay, so just go back a bit again, just to watch that again. Okay, so radius, ulna, radius spinning over, and then they'll take a little bit of this away, which is the capsule. So now you can see the head of the ulna. There's the articulations of the radius, TFCC, and then that will rotate back into supination. There it goes, and it just spins over. And see that attachment point there? So that's the attachment on the ulnar styloid. Yeah, so you can see why those styloids are really important, because there's a lot of ligamentous attachments all around that area. Yeah, so that's what that section looks like. So that's the end of your radius and ulnar bones. Now we're going to have a look at the carpals. Now there are 8 bones in the carpals, and if you're just learning these and you've never done them before, then they can be a bit tough to learn. So I'm going to try and give you some ways to remember these. So we've got, just move me there. So we've got 8 carpal bones, and they're arranged in 2 rows of 4. Okay, so that's a nice, easy way to remember them. And the rows do certain movements as well. So we'll have a look at that as we go through the videos. So if there's a restriction in one movement, then it may be related to one of the rows. It might be related to both, but it's more likely to be related to one row than the other. So then when you're doing your examination, you can try to be more specific with the areas that you're examining. Okay, so if you do therapy work. So the carpal bones give flexibility to the wrist as the rows glide along one another, and the rows are arranged proximal, so closer to you, and distal. So you have a row of 4 that is, and if you have a look, see that gap there? So that's the ulna and that's the radius, but there's no attachment, there's no facet joint on that ulna. So that's where the TFCC goes. It fills that gap so that then you can pronate and supinate, but also it provides the stability for the wrist. Okay, so it's a good, clever design. So we've got these bones here, so 1, 2, 3, and 4. So those will be your proximal row, so the row that's closest to you, and then you've got another 4 bones. Some of you can't see very well in this picture. Another 4 that are a bit more distal. Okay, so we're going to have a look at these rows, and then we'll have a look at the video so that you can see them for real. So this is where the hand gets a bit complicated. So let's have a look. So the proximal row, the row that's nearest to you. So this is the palm of you. So the best thing to do is if you put your hand next to this screen, and this is your right hand, and you got to look at your palm. Okay, so with your palm facing towards you, look at your hand, and that's what's on this picture. So on that thumb side, so your right thumb, looking at that, this is your radius. Okay, so and you felt the radial styloid already, and then you've also felt the ulnar styloid on the little finger side. So hopefully you can kind of imagine where that kind of section is there. And then we've got 4 bones here. So we've got a scaphoid bone. You might have heard of that before because it's quite common for that one to get fractured. We've then got this one, which is called a lunate. And then you've got another one, which is it's next to the lunate. It's called the triquetrum, and it's got 3 facets to it. Okay, so there's an articulation with the lunate, and there's an articulation with the pisiform, and there's also an articulation with the hamate, which is just in front of it. Okay, so that's part of the distal row. So we've got that one there, pisiform, that one there, triquetrum, that one there, lunate, and that one there, scaphoid. Usually what we do to help remember these is you go, there's a little rhyme, which I'll show you in a second. There's a rude one, and then there's a clean version. We're going to do the clean version today. You can Google the rude ones, or you can make up your own. So on the thumb side, you feel that radial styloid, and if you move your wrist, it doesn't move. Yeah, because that's fixed. That's part of your radius bone. So you know that you're on the styloid. If you're a bit too high, and then you can feel, and your thumb's being moved out of the space, then you know you're too high. Yeah, because you should be able to feel it, move your wrist around, and that point shouldn't move. So once you've found that point, you can then go up 1 and push in. Okay, so you literally just drop off that shelf and push in, and that's where your scaphoid is. Okay, and you can actually grip your scaphoid front to back, and you can mobilize it if it's a bit restricted. But it's an easy one to find, that one. So just off the radial styloid, literally the next bone is going to be your scaphoid, and it's on the thumb side. Yeah? So looking at palmar aspect, so looking at palm at you, it goes scaphoid, lunate, triquetrum, pisiform or pisiform, however you want to say it. Okay, so that's your proximal row. And then the distal row, the way that we do this again is we start on the thumb side again, and then there's a bone just underneath your thumb called the trapezium, and then trapezoid or trapezoid just inside. So we've got that one there, trapezium, that one there, trapezoid. Then we've got this big bone here called the capitate, and anything to do with cap, if you think of a baseball cap, it's shaped like a head. Okay, so the capitate bone in the middle of the wrist is shaped like your head. And then we've got this one here called your hamate, and there is a little hook on that, which you can see there, and that's really important for later when we learn about the ulnar nerve and where the ulnar nerve ends up. Okay, so the pisiform and the hook of the hamate are really important for later on. So that's the rows. Okay, and again, this is going to be one of those ones where you probably have to watch it a few times just to get it in your head, but I'll show you the rhyme in a sec to help you. So you go scaphoid, lunate, and the lunate, see if I can show you this, if I can get this on camera. Let me just go onto the big screen. So this is a real wrist. Just move that out of the way. Hopefully, can you see that bone there in between my fingers there? And it's curved. Try and get the right angle. There we go. That's a bit better. So it looks like the moon. Okay, and that's why it's called lunate, because of lunar. Yeah, so it looks like the moon. and that's this one just here. And what it does is it's like a C shape, so a moon shape around the capitate. Yeah, so you can see why the capitate then would be able to move into flexion and extension in that groove. Okay, cool. And then yeah, so this one, the pisiform, you should be able to feel that one. Again, if you've not felt these before, then feel your ulnar styloid, and then you have to come in a little bit. So you go medially, and then a little bit distally, and there is a pea-like lump just there on the edge of your wrist on the little finger side. Okay, so if you imagine you're looking at your hand again, so on that little finger side, there's that little lump there. And again, if you move your hand around, that little lump will move because it's part of the carpal rose. If you're a little bit lower, you're on the ulnar styloid, which feels very similar, but when you move there, it doesn't move. Okay, so ulnar styloid won't move when you move your wrist, but the pisiform will. Okay, and you'll be able to feel the bone move from side to side, whichever direction you're going in. So that's a nice way to differentiate between whether you're on this bony lump or that bony lump. Okay, so ulnar styloid and pisiform bone there. So there's a few ways to remember these, but for some of them, you have to have a bit of a Brummie accent. So it just so happens that, and if you're not from the UK and you're watching this, then Birmingham is in the middle of England, and we have a particular way of saying things. The best way to remember the trapezium, because we've got three bones that begin with T. We've got triquetrum, trapezoid, and trapezium. Okay, so to try and work out which one's which. So trapezium is under the thumb, and you've got to do it in a Brummie accent. And trapezoid is just inside. Okay, so if you've never been to Birmingham before, then they don't all sound like me. Trapezium is under the thumb, and trapezoid is just inside. And then you know that the other one's the triquetrum. So that's a nice way to remember those three T bones in the carpal rose. Let's have a right. What I'll do, I'm not going to go through all of these, but this is from the Trail Guide book. So the text is taken from that, and it will show you how to find each of these. We'll do a couple today, do a couple next week, but yeah, it'll take a while to go into all of those. So yeah, I'll let you pause that, and then you can watch that back, and you can use that text to help find some of the other bones as well. Like I say, some of them are really difficult to find, some of them are easier. It depends on the density of the tissue in your wrist. If you've got quite small wrists, if you've got quite bony wrists, then it shouldn't be a problem at all. If you've got whacking great big muscles in your hand, then you've got no chance of finding a lot of them. You should be able to find your pisiform, no problem at all, and the scaphoid. That shouldn't be an issue. So this is the clean version of the rhyme. So if you it really needs to be flipped, needs to be mirrored. So if you, well, mind you, now if we look at left hand, that'll be easier. So it's confusing having just done the right hand, and now we're going to switch to the left. So if you look left hand, okay, so you got your thumb on this side, and you line it up with the picture here. We're going to go from proximal to distal, so nearest to you to furthest away. So just on the top of the radial side, so on that head of the radius, we've got the scaphoid. Then next to that, you've got the lunate. Then you've got the triquetrum, and then you've got the pisiform, which is just above it. Okay, and the reason why we came up with this, because there was a girl on my course called Sarah, so it just helped us all remember. So Sarah likes to play. Yeah, so that's the first row, and it's from the thumb to the little finger, and that's the proximal row. So Sarah likes to play, and then you go back to the thumb. Okay, so have your left hand up there, trapezium, then the trapezoid, then the capitate, and then the hamate. Okay, so Sarah likes to play, and then back to the thumb, try to catch her. And again, if you Google rude carpal bones, then it will come up with all sorts. So whatever makes you learn the best, then go for that one. Right, let's have a look at the videos for this. So carpal rows, there we go. Okay, so let's have a look. So if we just orientate ourselves, so we've got the thumb side here, and we know this is the thumb. We haven't covered it yet, but this bone here is your metacarpal. Again, the way to remember between carpals and tarsals, if you remember tarsals and toes, then the carpals are to do with the hand. That's it. It's kind of process of elimination, that one. So metacarpal, that's that one there for the thumb. And then the thumb has only got 2 phalanges, but everything else has got 3. And we'll talk about that when we get to the fingers. Okay, so we know this is the thumb side, and this is a bigger bone than this one, so that must be the radius in the wrist, and that must be the ulna. There's your little styloid just there, and there's your styloid for the radius just there, which is a bit flatter, a bit broader. Okay, so we know it's Sarah likes to play. Okay, so that's that row, and then you go back to the thumb, try to catch her. All right, so that's those. That's where we are. Let's just have a look at those in a bit more detail. So carpal rows, proximal and a distal row, 2 rows of 4, and then your metacarpals just here, and then I think this is just going to focus on these. Yeah, so that's your proximal row just there, and then that's your distal row. So they do 2 different things. So we're going to have a look at some of the movements of these. So you can see how it's curved around that lunate. Okay, so remember the lunate is lunar, it looks like a moon. Got the pisiform. Let me just pause that there. So if you remember before they took the rest of the hand away, this was a right hand. So if you visualize this with your looking at your right palm, find your pisiform, that little pea-like lump just on the little finger side. That's basically where my arrow is pointing now. Okay, and then you've got the scaphoid, which is just above the radial styloid, just on this side. Okay, let's just play that. So we've got this curved structure here, and so we're going to get some flexion extension out of that joint because of the articulation here with the radius. And then if we have a look here, this distal row, so trapezium just under the thumb, trapezioid just inside, capitate, and then the hamate with the hook, and see how that is curved. So that fits into that proximal row. Just let them join those up. So there's the thumb. So that's the metacarpal for the thumb. So trapezium is under the thumb, trapezioid just inside, and then that's the proximal row fitting in to the distal row. Okay, so we get some flexion and extension from this distal row and all of them together. Okay, so flexion extension comes from basically all of the carpal joints, but you can get some from one and the other. But ulnar deviation and radial deviation comes from the proximal row. Okay, and if you've never heard of what the heck that is, that's basically doing like a queen's wave, where you do that. That's kind of how the queen waves, isn't it? So side to side like this. She does a bit of a rotation as well. But if you do that and that, so if your little finger is going that way, that's going towards the ulnar. So that is called ulnar deviation. And then going the other way, we've got, which doesn't go very far if you try, that's called radial deviation. Okay, so ulnar deviation going that way, radial deviation going the other way. And the reason why we can't get very much radial deviation is because of that whacking great big bone in the way there. Okay, so you can't radially deviate as much as you can ulnar deviate. Yes, you can ulnar deviate really far, but radial not so far. So if you remember in this part here, so because this is a right hand, I'll do it with my right hand. So that would be ulnar deviation because it's going towards the ulnar side. and there's that TFCC in here. So that's that cartilage. It's not bone. So you're able to, it will glide and squash that cartilage a little bit, so you can get more range of motion in that direction. Whereas coming this way, it's just pure bone, and there's not very much room. So that's why you can't radially deviate as much as you can ulnar deviate. Okay. Cool. Right, what time are we at? Right, we'll just do a little bit more, just so you don't go mad with how much you're taking in today. So yeah, let's have a look at some of the problems, things that can go wrong. So scaphoid fractures. 70% of carpal fractures are scaphoid, and if you've fractured your wrist before, then more than likely you're gonna have injured that scaphoid. 10% of hand fractures are scaphoid. Most prevalent in 15 to 30-year-olds, and that's from this paper by Rettig. Pain or swelling in what we call the anatomical snuff box. Now, what that is a little dip. I don't know whether you can get the right angle. There we go. So if you bring your thumb back towards your elbow, okay, so an abduction type movement, you can see these tendons just here and here, and it creates a shallow just there, okay, and in that shallow, that's where your scaphoid is. So that's one of the things that you can do to palpate to see if it's tender, if someone's fallen on their wrist, to see whether the scaphoid may be a problem. And it's what they used to use in the old days for snuff, which is like a type of tobacco. So they would put it into the snuff box, the anatomical snuff box, and sniff the snuff. So that's what that section is there. Okay, so we'll have a look at that later. Is it the scaphoid or lunate that you can feel sticking out more on the dorsal side of the hand? It's more likely to be the lunate rather than the scaphoid. Scaphoid is quite flat. It'd be quite depending on which way around you are, but towards the thumb side, that scaphoid is quite flat. As you come around, you may be able to, if you come in a little bit too far towards the fingers, you might be able to actually feel the capitate. The lunate as well is quite flat, to be honest. If you're in the middle of the wrist, then you're probably feeling the capitate. I'll show you a way to palpate that properly on the next session. If you're a little bit more laterally, so towards that little finger, then that's more likely to be the hamate. Okay, so the lunate is quite flat and it's quite small. So unless you've got your wrist fully flexed, you're going to find it difficult to palpate that lunate. You're probably feeling the capitate, to be honest. Okay, that's a good question. So let's have a look at this. Yeah, so I just want to introduce you to this now, and this will be something that we'll look at in a bit more detail when we go into the blood supply. So the scaphoid has its own blood supply, and one of the problems with a scaphoid fracture is if you disrupt the blood flow, then it will kill off the bone. The bone won't be able to have a supply of blood, and it will start to necrose. Okay, and you'll get something like this, where on imaging it will just look black. There is another condition called Kienbock's disease, which I think from memory is to do with the lunate. I'll have to check that. I think it's the lunate, but where if you injure the bone, then it can disrupt the blood supply, and then the bone will start to die. Okay, so it goes black on imaging, and it's called avascular necrosis. And necrosis means death, and avascular means without blood supply. So one of the issues you can have with falling on your hand and injuring that scaphoid bone, and why we're worried about it, is because you can disrupt the blood supply, which will then kill the bone. Okay, so it's something that needs to be checked out if you do therapy stuff. Cool. Okay, where are we? I think we'll leave those to next week. There we go. Whew. So whistle stop tour. We've got radius and ulnar, so the distal portion of the radius and ulnar we've had a look at. we've had a look at those rows of the carpals, and we'll revisit those next week as well. I had a feeling that the bones and bony landmarks of the hand and the wrist might take a couple of weeks to do. So best thing to do is go back over that video, pause it over those points where it's got the description of how to find the various bony landmarks, and then I'll go over them again next week. Just I think one thing to show you just before we go is to find the capitate, because that's probably the one that you were feeling before. And if you feel your middle finger, so you've got your phalanx or your phalange bones, then you've got the knuckle to your metacarpal phalangeal joint just here, and then that bone there is your metacarpal. And if you flex the wrist, feel it all the way down, you'll feel a bump at the end of the metacarpal, which is the end of the joint. And then the next bone down, so that one just there, that's got to be your capitate, because your capitate articulates with your third metacarpal. So that's another one for you. So that might be the one that you were feeling before when you're feeling something on the dorsum of the wrist. So you should be able to palpate your pisiform. The hook of the hamate is a little bit difficult because of this tissue here. This is called your hypothenar eminence. Again, if you've got very little tissue there, it should be easy to feel. You should be able to feel the scaphoid, so in that anatomical snuff box, and then it's in there. So if you find the radial styloid and then just drop off that, that's it there. Okay, so you should be able to feel those quite easily, and then depending on the structure of your hand, have a go at some of the others as well. Okay. Cool. If you got any questions during the week about that session, drop me a message in the Facebook group, and otherwise we'll finish off the bones and bony landmarks, and we'll start to bring in the ligaments of the wrist and the hands next week. And we are going to be here for bank holiday. They seem to be the most popular ones because everybody's off. So I'll see you at 10 o'clock next week. See you then. Have a good week.